Hello everyone, today we will discuss about services of the graduate pharmacists in healthcare system of Bangladesh is highly recommended, which is written by Professor Sheikh Feroz Uddin Ahmed of Jahangir University. Healthcare system, sometimes also known as the health system, may be defined as the processes, procedures and scheme of organization of the human and other necessary resources, the people, the health institutions etc., to provide the services aiming to serve the health needs of the people. Although in such of a system there might exist certain variations in the processing or delivering options of healthcare, there exist core similarities among the countries of the world. Healthcare system of a country gets evolution with its changes, history, political consensus, economy etc. Although the system may get evolution through market participation, in our country, it is structured mainly with the trials and decisions taken by the government upon the discussion and concern of the different healthcare components of the country. Bangladesh needs evolutionary changes for improving the quality of the healthcare services and to make necessary inclusion, changes in structuring of its superior healthcare providers into a coordinated system to deliver appropriate and secured healthcare services. Appropriate pharmacy care is needed in all of the healthcare contact points to incorporate to the appropriate medical care to result real benefits and health outcomes to the patients. Planning and designing for the appropriate medical cares to the sick people require good delivery of the professional care of the qualified graduate medical doctors who are qualified with a minimum of MBBS degree and duly licensed in the Board of Medical and Nursing Council, which also requires the incorporation, provision and delivering of the good pharmacy cares and services by the qualified graduate pharmacists who are having with a minimum of B.Pharm degree from a university and duly licensed from the Board of the Pharmacy Council. Under no circumstances, lawfully or ethically, medical graduate doctors can appropriately serve or deliver the pharmacy care jobs and the services to the patients similar in quality and extents of the professional graduate pharmacists. Thus, in securing the provisions and the maintenance of good and appropriate health care for the people, legal provisions for the employment of the appropriate proportions of the medical doctors and the graduate pharmacists, along with the employment of other categories of the graduate healthcare providers, are significantly required. It might be highly expected that the government, learned politicians and all of the healthcare professionals, social leaders, all of the intellectuals, the stakeholders of health and other socio-economic planners, have to consider and act for the salient causes and requirements of the good health of the people. Bangladesh has already produced enough number of all categories of the healthcare providers including the graduate pharmacists, who may be appropriately utilized in delivering the good and ensured healthcare services to the people. In no way, we the Bangladeshis, could overlook these facts and features and the requirements for the ensured provisions of good healthcare to the people. If you like this video, please share to your dear and near ones. Bye bye and have a nice day.